Hello everyone, let's begin today's session. Today we are going to try to attempt reading comprehension questions. I have divided the lectures in three categories depending upon the level of their difficulty. This is LOD 3, that is level of difficulty 3. Here we are going to solve two passages. In the first one, we are going to read the passage first and then we will give a go and solve the questions. And in the second passage, we are going to read the questions first and then the passage and then we will try attempting the questions. So without further ado, let's begin. Alright, passage 1. So, nitroglycerine has long been famous for its relief of angina pectoris attacks but ruled out for heart attacks on the theory that it harmfully lowers blood pressure and increases heart rate. A heart attack, unlike an angina attack, always involves some localized, fairly rapid heart muscle death or myocardial infarction. The acute emergency happens when the arteriosclerotic occlusive process in one of the coronary arterial branches accumulates so suddenly and completely that the local myocardium, the muscle area that was fed by the occluded coronary, stops contracting and dies over a period of hours, to be replaced over a period of weeks by a scar or healed infarct. In 1974, in experiments with dogs, it was discovered that administration of nitroglycerine during the acute stage of myocardial infarction instantly reduced the extent of myocardial injury, provided that the dog's heart rate and blood pressure were maintained in the normal range. Soon after, scientists made preliminary information of the clinical applicability of nitroglycerine in acute heart attack in human patients. 5 of the 12 human subjects developed some degree of congestive heart failure. Curiously, the nitroglycerine alone was enough to reduce the magnitude of injury in these 5 patients. But the 7 patients whose heart attacks were not complicated by any congestive heart failure were not consistently helped by the nitroglycerine until another drug, that is phenylephrine, was added to abolish the nitroglycerine induced drop in blood pressure. One explanation for this is that the flex responses in heart rate mediated through the autonomic nervous system and so blunted in congestive heart failure that a fall in blood pressure prompts less of the cardiac acceleration, which otherwise worsens the damage of acute myocardial infarction. It appears that the size of the infarct that would otherwise result from a coronary occlusion might greatly be reduced, and vitally needed heart muscle thus saved by the actions of certain drugs, other measures taken during the acute phase of the heart attack. This is because the size of myocardial infarct is not really determined at the moment of the coronary occlusive as previously thought. The fate of this thickened myocardial segment remains largely undetermined, hanging on the balance of myocardial oxygen supply and demand, which can be favorably influenced for many hours after the coronary occlusion. So it is possible to reduce the myocardial ischemic injury during acute human heart attacks by means or nitroglycerine, either alone or in combination with phenylephrine. Other drugs are also being tested to reduce myocardial infarct size, particularly drugs presumed to affect myocardial oxygen supply and demand, including not only vessel dilators such as nitroglycerine but also What is this? Antihypertensives, okay, which block the sympathetic nerve reflexes that increase heart rate and work in response to exertion and stress. Such measures are still experimental and there is no proof to benefit with regard to the 65 grade complications of heart attack, such as cardiogenic shock, angina, or mortality. But the drugs for reducing infarct size now hold center stage in experimental frameworks. Wow. Oh my god. It was a tough one. I would say it was a pretty tough one. I literally like 2 to 3 times in between the passage my mind literally boggled and I was like, what am I reading? I'm not able to understand this. But let's just read the questions and see if I literally understood it or it was just my brain because of loads of information that was embedded in one single passage itself. So let's see. Alright. Question 1. According to the passage, the primary difference between a heart attack and an angina attack is that a heart attack involves an acceleration of the heartbeat, cannot be treated with nitroglycerin, takes place within a relatively short period of time and always results in damage to the muscle tissue of the heart. I think it should be C. All of the above and both B and C, it should be C. Yeah, it should be C. Question 2. In the study referred to in the passage, the patients who developed congestive heart failure did not experience cardiac acceleration because the nitroglycerine was not administered soon enough after the onset of heart attack. The severity of the heart attack blocked the automatic response to the nitroglycerine induced drop in blood pressure. Administering phenylephrine migrated the severity of the drop in blood pressure caused by the nitroglycerine. Phenylephrine abolished the drop in blood pressure caused by nitroglycerine, and doctors were able to maintain blood pressure and thus indirectly the pulse rate in those patients. So it has to be what? B. Yup. Question number 3. Question number 3 says, the passage provides information to answer all the following questions except what are some of the physiological manifestations of a heart attack? What determines the size of a myocardial infarct following a heart attack? What effect does nitroglycerine have when administered to a patient experiencing a heart attack? What are the most important after effects of heart attacks? And E, that is none of these. So it has to be, I guess, D1 because everything else was mentioned except for this point, right? Question number 4 says, it can be inferred from the passage that nitroglycerine is of value in treating heart attacks because it lowers the blood pressure, stimulates the healing of an infarct, causes cardiac acceleration, dilates blood vessels, increases the myocardial infarct. Okay, so the fourth it seems is A, right? Lowers the blood pressure according to the passage. Question number 5. The author's attitude towards the use of nitroglycerine and other drugs to treat heart attack can be best described as one of a concern, resignation, anxiety, optimism, and pessimism. I feel it was optimism, right? Yeah, it was optimism. Question number 6. It can be inferred that the phenylephrine is administered in conjunction with nitroglycerine during heart attack in order to prevent cardiac acceleration caused by a drop in blood pressure, to block systematic nerve flexes that increases the pulse rate, to blunt the automatic nervous system which accelerates the pulse rate, to reduce the size of a myocardial infarct by increasing oxygen supply, and to increase the blood pressure. I feel for 6 it has to be A. To prevent cardiac acceleration caused by drop in blood pressure. Yeah. I feel it has to be A only. Yes. Alright. So with this we have done passage 1. It was very difficult. Like there were so many words I didn't know the meaning of. There were so many words I didn't know the pronunciation of. Like it was actually very, very difficult. But we somehow did it. So now let's do passage 2, So the way we need to do passage 2 is pretty simple. We need to first read the questions and see what kind of questions are there, so that we can have a fair idea of what the passage is about. And then we are going to read the passage and then we will solve the questions at last. So, passage 2. Questions. According to the passage, which of the following about the performance of euro is not true? Euro has underperformed against the dollar and yen both. Euro performed very well before Jan 1999. There is a little hope of a significant recovery of euro in the near future. There was a definite hope of a significant appreciation of the euro. It needs to be seen whether the value of the euro matters at all. So I feel the passage is going to be about currencies. From question 1, it seems that way itself. Question number 2. It can be inferred from the passage that some people see the euro's external value as a symbol of Europe's economic strength. Some people hope that the introduction to euro note coins and notes would transform the future of Europe. The hopes of euros gaining strength against the dollar crashed. Again, I feel it's about currency. Question number 3. According to the passage, does euro's weakness matter anyway? Okay. Question number 4. From the passage, all of the following cannot be inferred except America is all set to come out from the current downturn. The current global downturn has destroyed the confidence of people in American economy. The current global downturn contradicts the popular belief about the resilience of the American economy. The judgment of many economists would most likely not be vindicated. The euro is crucial for the world economy. Question number 5. According to the passage, the term euro area stands for what? European countries, area of Europe, euro's area of circulation, members of the European Union, or German and Britain. So I feel this passage is going to be about the currency. So without further ado, let's read and find out. It's a pretty long passage. Okay. Hopes of a significant appreciation of the euro have faded yet again. As the dollar surges amid talk of a speedy recovery in the American economy, does the weakness of a single European currency matter? How do they know? Asked Dorothy Parker when told that the former American president Calvin Coolidge, famous for his inactivity, had died. It's a bit like that with the euro. When people start fretting about its weakness, it's tempting to point out that it was ever thus. Since January 1999, when the European single currency came into being, it has consistently underperformed expectations about its value in relation to American dollar and to a lesser extent, the Japanese yen. So the latest bout of euro anxiety prompts 2 questions. What's new this time? And does euro weakness matter anyway? It's difficult not to sympathize with those who wonder what the latest fuss is about. One second. It was referring to, alright, it was, okay. I got confused there, but it was referring to Japanese yen before and now it's talking about euro. Alright. So it's true that since the beginning of the year, the euro has once again seen its value against the dollar fall. It's also true that this has been a disappointment to those who see the currency's external value as somehow symbolic to Europe's economic strength and who had hoped that the introduction of euro notes and coins on January 1st would somehow transform the new currency's fortunes. But as often happens with discussions about exchange rates, too much emphasis can be placed on short-term fluctuations. Such debates are also prone to exaggeration. The euro has lost about 3 to 4% of its value against the dollar in the past month. It may yet lose more, but so far it remains above the lowest point it has reached in the past 6 months, and it's still significantly higher than its all-time low reached in October 2000. And while in the short term it would be a mistake to attribute too much economic wisdom to the foreign exchange markets, it's not difficult to find reasonable expectations for the euro's deadline. Foremost in the judgment of many economists that America is now poised for recovery from recession And if the trends seen in the latest data are confirmed to do so more quickly than many people had anticipated. Okay. Of all the world's rich economies, America has persistently proved the most dynamic and resilient. And nothing that has happened during the current global downturn seems to contradict that. It is, of course, possible that the optimists are taking too rosy a view of American prospects. Although the Federal Reserve decided against another cut in interest rates last week, it sounded a note of caution, taking about the continuing risk of economic weakness, but the euro area's performance has given much greater cause for concern. Most economists reckon Germany, the world's third largest economy and the eurozone's biggest, is in recession. The Germany downturn, moreover, came after a relatively brief and half-hearted upturn, especially when compared with the longest peacetime expansion in American history. The Euros area's lackluster economic performance has disappointed many of those who had detected signs of a stronger commitment to reform, especially in Europe's traditionally rigid labor markets. In the event reform has been slow to materialize, the most Euro area economies have a long way to go before their labor markets are as flexible as those in America or even in Britain. Plans to dismantle state-run monopolies and to open Europe's market to greater competition are also taking much longer than to push through than previously seemed likely. Seen in this light, the relative weakness of the euro is helpful for the eurozone economies. The lower the value of the euro, the more competitive are euro area exports to the rest of the world. Indeed, some big American manufacturers have recently begun to complain about the strength of the dollar, both in relation to euro and the yen. They are finding it harder to compete in world markets. Indeed, it's possible to argue that euro's continuing weakness is at least partly an inevitable reflection of the dollar's strength. The American currency has consistently defied predictions of impending collapse. It remains the currency of choice in times of trouble, as its sharp appreciation since the war on terror that began after the events of September 11 has shown. The good news for European exports is that the American government shows no sign of seeking to push the dollar down. There is great skepticism in Washington about no sympathy for American manufacturers who lobby against a strong dollar. Good companies, he argued, do not live or die on exchange rates because the dollar is still the world's principal reserve currency. There are large holdings of dollars outside America. Any pronounced and prolonged decline in its value ultimately depends on there being attractive alternative assets for people to hold. Many Europeans, or at least European leaders, had hoped that the euro would assume this role. For some, it was a matter of pride, which the new currency's weakness has bruised. In fact, the figures showing an increasing number of private sector bonds issued are denominated in euros. For example, oh my god, it was such a lengthy passage. I almost felt I'm lost in between the passage, but still, we finished reading, and I'm very, very glad that I understood it. Hopefully, you people also understood it. I know it was very long. I'm so sorry. But this is how level 3 is. This is how LOD 3 is. It's not simple, people. It's just not. But yeah, of course, we got through the passage, and I'm really happy that I understood it. This one was pretty simple than the previous one. Maybe because I do not belong to a medical background, so there were so many terms that I didn't understand. But never mind, let's solve the questions now. Now it will be easier because now I know. Okay, so let's start. According to the passage, which of the following about the performance of euro is not true? Euro has underperformed against the dollar and yen both. Euro performed very well before Jan 1999. There is little hope of a significant recovery of the euro in the near future. there was a definite hope of a significant appreciation of the euro. It needs to be seen whether the value of euro matters at all. Obviously, it's B, right? Euro performed very well before January 1999. Question number 2. It can be inferred from the passage that some people see the euro's external value as a symbol of Europe's economic strength. Some people hope that the introduction of euro notes and coins would transform the future of Europe. And third is the hopes of euros gaining strength against the dollar crashed. So I feel here it has to be first one is correct, and I guess the second one, yeah, true. So it has to be C. So here option C is correct. Alright, question number 3. According to the passage, does euro's weakness matter anyway? Definitely yes, probably yes, definitely not, probably not, and nothing can be inferred. So I think it has to be D, probably not, because the passage doesn't, say that euro's weakness matter or something like that. So it's not that. Alright, question number 4. From the passage, all the following cannot be inferred except America is all set to come out from the current downturn. The current global downturn has destroyed the confidence of people in the American economy. The current global downturn contradicts the popular belief about the resilience of the American economy. The judgment of many economists would most likely not be vindicated. Oh my god. Vindicated. What happened to my pronunciation? I'm so stressed right now. Never mind, okay. The euro is crucial for the world economy. I feel for fourth it has to be A. America is all set to come out from the current downturn. Okay. Question number 5 says, according to the passage, the term euro area stands for what? European countries, area of Europe, euro's area of circulation, members of the European Union, and Germany and Britain. So, euro area was basically referred to as the euro's area for circulation, right? It was referred to as the euro's area of circulation. So, with this, we did the passage 2 as well. Yay! So, I'm so happy that we did both the passages. These were really very tough. So, the first passage was done how? We firstly read the passage and then we did the questions, and the second passage was done how? We read the questions first and then the passage and then solved the question. So these are two different methods which you can apply while solving your reading comprehension. And I hope you people also completed these passages because oh my god, they were actually tough. Never mind. All the best, and just go to EduRev's website, solve more and more questions so that you are more familiar with the topic of RC and you can practice more and more and get good with it. So all the best. Take care. Bye-bye.